Tēnā koutou katoa, no mai te whānau ki webinar, ki Outcomes Harvesting Evaluation, the missing piece of the puzzle, i Tangata Whenua Community and Voluntary Sector Research Centre, Community Research. Kua tai mai nei te tautoko e tēnei kaupapa, e kauri e mutu aku mihi. Ko Pākia hau, ko Janie Walker, tōku ingoa, he Kaiwhakahaere Matua hau, e Tangata Whenua Community Voluntary Sector Research Centre. Welcome everyone to this webinar. Thank you all very much for being here in these unusual times. I'm Janie Walker from Community Research. I'd like to just bring us together with a short karakia. Tuia ki runga, tuia ki raro, tuia ki waho, tuia ki roto, tuia ki here tangata, ka ronga te pō, ka ronga te ao. Humi e, hui e, tai ki e. I'd just like to first acknowledge that it's a really hard time for some people. We wish you lots of aroha and strength, and we hope that you're able to get the tautoko support that you need at this time. This webinar is 30 minutes, followed by a 30-minute workshop. You're welcome, obviously, to stay for both. We'll be recording just this webinar section. There will also be an opportunity to share your thoughts and your questions at the end of the workshop. We'll have breakout rooms in the workshop as well. At any time, please add your comments or your questions in the chat. These may be answered throughout the webinar, the workshop. Aroha mai if they're not, but we will answer them and put them up on our website shortly after the webinar. So I'd like to introduce Jeph Mathias from Unpredictable. Jeff's values speak as loud as his outstanding global experience and qualifications, that of integrity, of equality and of inclusion, amongst others. He has many degrees, quite wonderful experience. He teaches wilderness medicine. He's a medical doctor. He's the joint chair of the International Outcome Mapping Learning Community. He ditches that swear word C consultation in favour of participatory action approaches so that outcomes are achieved for people. But best of all, he's had a cup of tea with Mother Teresa. Jeph will introduce the lovely Suzanne Andrew and some other people who will answer some specific partai questions about outcomes harvesting in an Aotearoa setting. So, ngā mihi, Jeph, over to you.
Kia ora, Janie. Tēnā koutou katoa. Ko Jeph Mathias tōku ingoa. It's a complete delight to be doing this. As Janie said, I am a medical doctor, but I've chosen to do other things with most of my life because I think the stuff we dreaming of a different world, I think that's more important. You know, we're trying to build a different world. Janie's given me the amazing challenge of covering outcome mapping and outcome harvesting in half an hour. So we better get into it. It's quite a lot to cover, but there's not too much. The key stuff's really, really simple. I'm going to share my screen for a minute. And there we go. Share that. And we'll play the slide. Cool. So that's probably the biggest point up there. It's about systems and it's not about us. That's a big deal. We come to this world with a big dream of the world we'd like to see and the vision we have and all that kind of stuff. And we start looking at it and we say, there's certain people that we're very interested in out there. Maybe the ones in orange. Those might be the kids who can't read. Those might be the people living with HIV, whatever. That's our vision. That's our mahi. We'd like to change that in this big, bad, beautiful, ugly world out there. What's it? And then we look at ourselves and we're pretty small compared to that. Compared to our dreams, we're tiny. So this is the outcome mapping way of thinking about it. You say the orange ones are the people of interest, the red circle's us, we're very small, but there are system influencers out there. And if we define a green circle, our sphere of influence, some of those influences are within our sphere of influence. And we call those boundary partners. Remember that term, Suzanne will talk about it in a second. Our work, the red arrows, is all about working with those guys. Boundary partners, system influences within our sphere of influence. And we'd also try to build red arrows, the relationships between them. But the key thing is the green arrows out here. The green arrows are how those guys, the system influencers, think differently, behave differently, make different policies, and have different relationships. And from the sum of those green arrows, that is where, in outcome mapping, that is where our vision, we think that really emerges from. So that's the key diagram for the whole thing. And we'll just go on to here. And if we disappear, if we've really done that work, they still keep on thinking, behaving, relating, acting in different ways, carries on. And just to contextualize that, here's a immunization camp in the middle of the jungles of South America during the war about 20 years ago. And a traditional it's all about us kind of project would focus on the vaccines and the needles and the baby's bum that's going to have a needle pointed into it. But outcome mapping says it's not about us. What it's about is about why this Indigenous woman, what she's thinking of when she says, yes, I'll take my baby to be vaccinated. And what this government nurse says, yeah, I'm in an Indigenous village for the first time in my life. I'm actually working out in the community. And the relationship between them, and the relationship between the government nurse and a NGO worker, that's from Doctors Without Borders, who I was working with, and what's going on for all the people around. What are they thinking about? So that's the difference between an outcome mapping and a traditional way of looking at the world. Outcome harvesting just takes the same ideas into evaluation rather than designing the project. It says, how can we evaluate it? How can we ask the question, how are we doing? Only two important points in outcome harvesting to think about. One is reverse logic. I'll explain that in a second. And the other is outcome centered. That's all of outcome harvesting. Outcome centered. Outcomes are defined as a change of behavior, attitude, relationship, or policy in outcome mapping. Some people in outcome harvesting would say you only get the ones that you can really, the hard outcomes, the ones you can prove new behavior or policy, because I can't see a relationship and I can't see an attitude. I'm different. I'll take in the fourth, and that's more technical discussion. It's all about outcomes. It's what other people do. And the reverse logic, a normal logic says, here's the world, and we look at our project and the activities it does, and that creates impact. And we might, if we're very broad-minded, at the end of that, think about the context and what's going on. You come along to evaluate that, and you just look at that straight line in the middle there. And in fact, most evaluators don't even look at that straight line. Most evaluators just look at that. What did the project do and what happened? Everything else is out of their mind. A reverse logic is first start with the context and all the complex stuff going on there, and kind of work backwards from there. What's going on regarding our kids in New Zealand reading, people with HIV being excluded in Indonesia, whatever it is. And in the center of that, and my slide's not working, how people and institutions think, relate, behave, and make rules impacts on the context, and the context impacts on how people, so there's this kind of complicated, and it's messy and it's complicated, but hey, that's the real world. It is messy and complicated. Inside that, we do draw a straight line of causality. What our project does works on people, works on what's going on. But the key thing is that's where outcome harvesting looks, and that's all where outcome mapping and outcome harvesting, that's where they look, and that's all. It's not other bits. Right in the middle, that's what it's all about. So if you're evaluating, that's the diagram I showed you before. You're always going to try to harvest those green arrows, the outcomes, who's behaving differently. You may ask questions about whether the system's changed in your evaluation. You may ask questions about what the boundary partners have done and what our work with them has been about, and where that change has come from. And with that, I'm going to hand over to Suzanne as we put that into our pipes and smoke it. I'll stop my screen share. And Suzanne, you're on.
Thanks, Jeph. I'll just find my presentation. Morena tātou, ko Suzanne toku ingoa. So I was fortunate to go to Cambodia with Jeph Mathias in May 2018, quite a while ago now. But it did actually make a huge impact on my life. And I was a master's student of international development with Massey University at that stage. So next slide, Harry. So Jeph and I, we had a cultural advisor and translator with us, Sam Nang, and she was just the most amazing Cambodian woman. We had 2 weeks and a huge itinerary with lots of meetings across 3 kampong, 3 provinces in Cambodia. It was quite tight to get between locations, and sometimes we were late and felt quite awful, but people were very gracious, and we're very honoured to be able to come into people's lives and talk to them about what had changed for them over the past couple of years. Next slide. So it wasn't just Jeph, Samdang and I, it was also a lovely group of COMET field workers across the 3 provinces. And although we weren't able to fully communicate with each other, it's amazing what hand language and smiles and games of petanque can do. Next slide. So we met with boundary partners, and we had quite a few to meet with. We met with village leaders, village development associations, school committees, community development associations and commune councils. And we also talked to villagers. Next slide. So we're really listening for outcomes, and outcome harvesting was all new to me. I'd done a course in Bangkok for 3 days to learn about outcome mapping and outcome harvesting, which was useful, but really it was learning as we practiced. So as we spoke to villagers, we asked about what change they had in their lives and what impact the NGO, the non-government organisation that we were doing the review with, what had they done. Then we also went a little bit deeper and asked why did they think that had changed? What could they attribute that to? Next slide. So it was all going really well, and Jeph and I spoke to one of the donors, and we were like, oh, this is amazing. The NGO is doing incredible work, great outcomes. And then one day, I don't know whether it was Jeff's idea, but we decided to go off track, and we gave our schedule of interviews to another team, and we said, we're just going to walk through a village and talk to whoever's there, expecting a full village. But a new story emerged. We found the villages quite deserted. We found these 3 young men who drive concrete trucks there. We found a young girl who was 15 who looked after cows and really didn't look like she was enjoying looking after cows, sitting with her grandmother and another elderly woman. The whole village was just deserted. Like, there was really no younger women, not many middle-aged women, a lot of elderly women, some children playing. We asked, what's happened? Where is everyone? And we hadn't realised the impact of factories. Do you want to go to the next slide, Harry? So here's like a garment factory. So every morning a truck would come and pick up the women from the village and take them to the garment factory. They would work all day and come back very late at night. So the responsibility for raising children was given to the elderly women in the village. We also met a lovely woman, and her husband was working in construction in another country, and he'd be away for several weeks. And we asked whether she was happy, and she said she had no choice. Next slide. So just wrapping up the Cambodia part of what I'm going to talk about. The NGO was doing amazing work, but the boundary partners they had been working with had less relevance to the people in the village because they were spending so much of their working life outside of the village, earning money, building concrete houses, having mortgages. So there was less influence on raising livestock, growing home gardens. Their whole life was outward looking. So just moving into a New Zealand context, I'm a change manager with the Bay of Plenty District Health Board. So I work in the health system, and it's a big system and it's complicated, and we still tend to work in silos, which is a bit of a pain. But I've been involved as a support for a small test of change in the acute diabetes area for Māori patients. So what happened was the pre-assessment service and the diabetes service realised that Māori patients, when they'd come for pre-assessment for their surgery, their diabetes was kind of out of control, so they weren't able to safely have anesthesia and have their surgery. So our system says, oh, you're not suitable, secondary will refer you back to primary care. So they come under the care of their GPs. But what was happening was those Māori patients weren't actually getting their surgery. They weren't being optimised. So secondary said, hey, this is not okay. Let's do a small test of change and we'll invite those Māori patients back into secondary care and see if we can do health differently. So instead of coming into an outpatients department as an individual, we said to a small group, would you like to come together and meet in our Māori health service, Te Pariotoi? And there you'll have cultural supports, have whakatau, kai, come and join, and it's a safe environment. And we've got a lovely Māori health navigator who's just so key in making this a success, and also our kaupapa nursing. So some of those comments are there, they're directly from patients, and that was after their first clinic. So that was 22nd of July. So since then we've had 2 patients optimised for surgery, which is fantastic. By talking to the patients, it wasn't just a change in location, it was things like had felt like the only one in the world. So what we did was, instead of it being quite a lonely, isolated individual journey through our health system, it became more of a shared joint journey, and it was joint kaupapa too across our mainstream and our Te Pariotoi service. So we've just been thrilled with how this is going. The patients themselves have asked, oh, can I have contact details for some of the other members? I want to keep in touch, and they encourage each other. So learning about outcomes has really been part of our evaluation. That's it from me. Ngā mihi.
Kia ora, Suzanne. That was great. And I loved sucking the marrow out of lobster and coconut milk in the streets of Phnom Penh with you, Suzanne. It was great. We reminisced about that. What I'd like to reiterate at this point is that outcome mapping and outcome harvesting are tools. One's a design tool and one's an evaluation tool for projects. But at the rock bottom, what they are is a philosophy, a way of thinking what's important. And what is important? People, the way they think, the way they relate, the way they behave, and the way they make policy. That's the key thing. So that's a transferable thing, why outcome mapping and outcome harvesting is relevant in Cambodia and in Bay of Plenty District Health Board. And I'd just like to now invite, we're very lucky to have Susan Warren and Raj Krishnan from COMET in Auckland, who are just going to tell us a little bit about how that's applied to them. So if you two guys, Susan and Raj, if you unmute yourselves, and we'll just have a couple of quick questions for you. And to start off, Susan and Raj, what is the system you're hoping to change? And what is that system made of? What are the components of that system?
So kia ora koutou, ko Susan Warren ho, ko Te Kaiwhakahaere or COMET Auckland. So COMET is an education trust. And the system we're trying to change is the education and skills system, nothing small, to try and get better equity of results. So if we think about that, we're thinking about the formal system, schools, early childhood centres, tertiary education settings, and then the government departments that influence them, so Ministry of Education, NZQA, ERO, a range of others. And then the less formal settings where you learn. You learn in your family, in your community, at your workplace, and actually employers are part of the system too, because they're the customers, if you like, one of them. They have an interest in what their workers know and can do. So it's a big system of a range of people to influence.
Yeah, no small bite of the cherry, Susan. It's huge. What can you guys do to change that?
So essentially, we're a think tank and an innovation hub. So we look across at the data and evidence, and we listen to a whole lot of people and work out where are there places where we could make a difference for equity with the partners that we've got. And then we bring people together to go, hey, what could we do about this? And so quite often the thing that we can do is innovate some new approach to some part of the way learners are supported, and trial it and work it out, and at the same time engage with as many of the players as possible to bring them alongside. So we would have, you know, we'd be keeping government and government departments involved and informed. We'd be also working with the key providers that might eventually take this up, with the purpose of it becoming, you know, business as usual for that. And that you're talking about a 10-year, 5 or 10-year process there. This is not easy, right? And just to give you a small example, not small for us, one of our dreams for years has been that every young person, as they leave school or tertiary and move off into the world, have the soft skills, the employability skills that they need to actually do that successfully. And we've been running a program, designed and have been running a program since 2015. But it's not about the program, it's actually about influencing government, who now have a framework for employability skills. They didn't have that when we started out, they didn't even think about it. And secondly, influencing other providers that work with young people. So actually across the country, there's a whole lot of employability programs springing up. You might look at that and think, oh dear, competition. Actually, it's a success because we can't reach every young person in Aotearoa, but across the network of people, it is possible to do that. So example of maybe one of the more obviously successful ways that we work.
Fantastic, Susan. And obviously you guys kind of dreaming of system change and seeing some evidence of it. If you wanted to evaluate, say, well, what's changing? What have we achieved? You're looking back and say, what's COMET done? Have we done our mahi well? How would you go about doing that?
So what as Susan said, COMET is a think tank and we have different sort of projects running. So what we're planning to do over the next 6 months is to bring together all of our different projects. So these employabilities, the talking matters and all of that, get them thinking well before we have our first meeting, what matters to them, what changes would they like to see or would have seen for the last X amount of years that they've been doing their work. And then bring together some of also our key stakeholders to understand what the big changes or the dreams or the aspirational things are, and the changes that we'd like to see to this big system that we work in. And then maybe start sort of trying to go back to some of the evidence that we've got and sort of trying to see if COMET or any of the different projects has actually created some change or helped towards creating those changes that we were hoping to see or have seen. So that's what we're kind of doing.
Thanks, Raj. So you guys, you're dreaming of changes from government policies to a kid sitting on his dad's knee in a South Auckland house listening to him read a story, and everything in between. What's outcome mapping and outcome harvesting added to that?
That's the thing, because we've got such big pictures, such big dreams, it's kind of helped us sort of think about what's achievable and what's not achievable, who our key partners are, what value has our work sort of given, and what is it that we should be focusing more time and energy on moving forward, as well as sort of what we've done previously. So what's worked for us, what's haven't worked for us, and what do we need to change, where do we need to grow, that kind of thing, and hopefully sort of capture those big ideas and put them into more achievable, attainable, bite-sized pieces for us.
Ka pai, Raj and Susan, thank you so much for sharing, guys. Time ticking ahead. So I'm just going to quickly wrap up now. Our half hour is coming to an end. Key things that I think what we're talking about, outcome mapping and outcome harvesting, everything we do, all of us, everyone in this webinar, we're working in some kind of system or other. Secondly, systems are made of people or groups of people, maybe institutions, whatever. And that's what we're working with. That's the elements of a system. And thirdly, we can change that. And think of a country, the whole world, no woman voted on until about 120 years ago, whatever it was. Systems change. Think of apartheid falling in South Africa. Think of the way we deal with treaties. Systems change, things are possible. Outcome mapping and outcome harvesting are tools to help us do that, but primarily they're both a philosophy, a way of thinking about how this fantastic flawed world we live in is made up, what makes it up, what our role in that is. That's my summary, and I'll hand back to you, Janie.
Kia ora, Jeph. Thank you, everybody. Yeah, we're doing a light, deep touch, so thank you. We do have one question. We've got about 4 minutes for questions, so we will take advantage of it. Someone has asked, love the theory behind outcomes mapping, the great emphasis on emerging context, relationships and systems. What does harvesting outcomes, the green arrows, look like in practice? And perhaps that's been answered a little bit here. Do the outputs change as a result of using this process? Over to you,
Lovely
Jeph.
question. Thank you very much. So harvesting gives you that image of going out there and find it first and then figure out where it came from. So you go and harvesting, and Suzanne just touched on this. Most of it is qualitative. You're going to go out and actually listen to people. Interviews, qualitative interviews, listen to people, but also you're going to look for policy documents. You're going to look for the numbers of mothers now taking their children for vaccination. That's a behavior change. So you try to, it's a mixed methods approach. Harvesting goes for hard data that talks to behavior, attitude, relationship, or policy. Look for the policy documents. But a lot of it also is the inverted commas soft data. And I think in terms of learning, it's the soft stuff. It's kind of richer and more complex. And I'm just going to.
That's wonderful.
We've got 3 minutes, and I meant to do this.
We've got just one other question here. So after that, Jeph, we'll
I've just picked up the chat here. Rebecca, lovely question. How's this similar or different to the most significant change method? And Rebecca, my common answer to that question is outcome harvesting is the same as most significant change, except most significant change had this way of getting a whole lot of stories and filtering out and say this or these ones are the most significant. Outcome harvesting says, guys, every change is significant. You collect them all. Now that we have electronic databases, we can handle that stuff. So, but in terms of the philosophy, very, very much the same thinking.
Jeph, we've got a cool question there too from Malena around, do you have any examples of this approach alongside kaupapa Māori, rangahau, and or any other Indigenous research approaches?
Unfortunately, not yet. I've just done an outcome harvest with community research, which this webinar is with. I've been overseas until, and as far as I know, I'm the only person who does outcome harvesting in New Zealand. I've been overseas until when the pandemic came along last year. But hopefully, Miranda, I'll be able to say yes to that. And at 1 or 2 years' time, I really want to. I'm learning Te Reo now, and I love the concept and putting all that together. Fantastic.
And Malena, if you'd like to get in touch with us, we'd love to tautoko your inquiry too, because it's a question that community research has. So thank you for that, Pātai. That's really important that we, as an organisation, address that. So we'd love to hear from you if you just get in touch with us on our website. Jeph, is there anything else you would like to say before we wrap up, just the webinar side before we go into the workshop side, or Suzanne?
I'd just like to say thank you to everyone. Suzanne, Susan, Raj for helping present, but also to all of you guys for being there with your brains turned on and your hearts turned on. I think we're all dreaming of making this a beautiful world even more beautiful. So thank you all.
Oh, kia ora. I think I'm feeling a webinar hug.
Yeah.
A group hug come along. So yeah, ngā mihi kia koe, ngā mihi kia korua, ngā mihi kia koutou. So that brings us to the end of the webinar format of this. So yeah, thank you everyone for joining us.